my name is Vanessa and we're going to go over the crash cart today. So we'll just go over a little bit what's on the outside. Every crash cart in the hospital is set up the same way. We should all have the same supplies. So we're always going to have an ambu bag. This one actually has two on it. We're going to have an ambu bag, a backboard, and then there's usually an O2 tank on the side of the cart. We are going to have our defibrillator. We're going to have a bag on top that will have different supplies. It'll have the pads, suction, a razor if you need to shave any hair, and there's also going to be a binder which houses the record if you ever have to run a code. Okay, so we have our adult quick combo pads here. There's pictures right on the pads to show you exactly where to place them if you're ever in doubt. It does have a connector here, which you will connect to this cord that's always on the back of the machine, and you go arrow to arrow and it just snaps in like that. And then you also have your pacing leads here if you need those. We use the LifePak 20 in this hospital. Very basic functions. You have your on button here, your dual selection here, charge button, and then you have your shock button. So this whole top section is for defibrillation. If you move down to the bottom here, this is for pacing a patient. Okay, so we're just gonna briefly go over what's inside each drawer here in this cart. Like I said earlier, all the carts in the hospital are set up the same. So the top drawer is gonna be your meds. So you can kind of take a peek in here and see everything that you have going on, but this is where you'll go to for all medications. Okay, so we're just gonna briefly go over some of the medications that are in the top drawer of the cart here that are used to resuscitate a patient. So you're gonna have some Epi, you're gonna have some D50, we have calcium chloride here, Narcan, 2% lidocaine, atropine, we have some metoprolol here, flumazenil, vasopressin, dopamine, dobutamine, sodium bicarb, amiodarone, and we have some saline flushes here. Second drawer here, you're going to have IV supplies, so you have some fluids, and all of the catheters, anything that you would need to start an IV, as well as send labs if necessary. Third drawer, looks like you have some dextrose in here and additional IV tubing. Fourth drawer, you have some saline, central line, and some sterile gloves. Fifth drawer, we have a blood pressure cuff, a stethoscope, suction tubing, and it looks like some eye protection and masks in here. And then the bottom drawer is going to be anything that you need for intubation. So this is all set up for anesthesia should they need to secure an airway. And there's additional supplies in here. So I'm just going to show you how to set up your epinephrine injection here. When you take it out of the box, it's going to come like this, and you're going to have a couple yellow caps. You're going to remove those caps. And it's going to look like this. There is a needle here, so don't poke yourself. All you're going to do is take this, screw it in, and then you're going to come down to this end. You can remove this yellow cap by going counterclockwise, and then you're now ready to push. If you want access to the needle here, you just take this off and you have your needle. There are instructions on the back of the box if you ever have any questions on how to set this up.